Welcome back to Renovate Ed, a podcast where we don't just talk about fixing houses, we talk about everything that's related to home and home maintenance, including how the spaces in which we live contribute to our health. I'm your host, Jennifer Goldsby, and this episode is one that hits especially close to home. If you've been following my story, you know that mold has been a huge part of my personal journey, not just in terms of home remediation, but also how it's impacted my health. Mold toxicity isn't just disruptive. As one of my guests, Valerie, she often says, it's also an incredibly expensive illness to manage. That's why I wanted to dedicate this episode to exploring the connection between mold, food intolerances, and our overall health. In this first half of today's conversation, I'm joined by Valerie Polley of Blue Tree Nutrition. Valerie's education and her guidance were instrumental in helping me identify which foods would actually work for me, and it took some work. Through her process, I also discovered that I was suffering from something called SIBO. She brings such valuable insight into how mold can contribute to food intolerances and the many ways that nutrition can support healing. In the second half of this episode, I speak with Alissa McDivitt of Spark Vital Health. Alissa is a nurse practitioner and a certified functional medicine provider. She helped me untangle the complicated health issues that mold can create, and they are complicated. Before I bring them in, I want to share a little more of my own experience. For some time, I was working with a physician's assistant who billed herself as a functional medicine practitioner. It was incredibly expensive to see her. In the end, though, I found out she wasn't actually certified to do functional medicine. And after months and months of buying expensive supplements and treatments, it became very clear she hit a wall with my case. I was doing very poorly. I could barely function. And during one appointment, she said to me, "If you think this is bad, you should see my other patients." And I remember asking her, "You mean you have patients that are worse than me?" And at that point, I literally felt like I was dying. I couldn't imagine others feeling worse than I was feeling. And when she confirmed yes, she had patients with similar symptoms to mine that were even worse, I knew immediately I was in the wrong place, asking the wrong person for help. That moment set me on a path of research to understand what functional medicine practitioners do and to find another one. I had to do some digging. That's when I found out the gal I was seeing was not certified as a functional medicine practitioner. And eventually I found Alissa. I find Alissa to be someone who really understands the bigger picture and has a lot of empathy for her patients. She helped me to address underlying health disruptions caused by mold I had no idea existed. So, whether you're here because you've dealt with mold exposure yourself, you know someone else who's experienced it, or you're just curious about how it can affect your health in ways you might not expect, these ladies share a lot of good information. Enjoy. I had forgotten that you had a mold event yourself. So, tell me a little bit about your mold event.
We moved back to the Midwest in 2008, and I was in my 30s. I had a baby. We moved when he was only like 2 months old, a 3-year-old and a 5-year-old. And we moved into a home that we were second owners. And in 2009, I started to not feel well. And just prior to that, the only thing I had were headaches. I was seeing a new neurologist for my headaches and just started with more of like body aches, a severe joint pain. I was nauseous all the time. I felt feverish. The only way I can explain it is I felt like I had the flu every day. And it must have ebbed and flowed. Probably I'm thinking in terms of maybe in the springtime we had the windows open, fall we had the windows open. I don't remember. Because then in 2015, I saw a functional medicine doctor because I didn't know why I was in my 30s and felt horrible. She told me I was sick from mold somewhere and it had probably triggered a Lyme disease. So,
What you mean you had Lyme disease and it triggered like a flare up, maybe?
yeah, I mean, I think there's some belief that Lyme can be dormant. And I was a very outdoorsy kid. I mean, I had ticks that were taken off of me when I was little as a child. So she said I was sick from mold. We didn't know if it was like in a workplace or my home, but to make a very, very long story short, because there was some issues with the mold company that first tested my house, I found out we had Stachybotrys in our kitchen. Our dishwasher was leaking and going underneath our hardwood floor. And then we had Aspergillus in our basement, partly because it's a basement and it's damp, and partly because we had a open crawl space that wasn't finished properly, sealed properly. Even the people that owned it before, it wasn't sealed properly. And even in our inspection, we had no idea until the mold company came out and said, oh, this is constantly creating dampness, even though it didn't feel damp in the basement. And the one thing with Aspergillus is it's not a black mold. So they actually had to show me with a flashlight.
Like a flashlight.
With a flashlight. It almost looks like opaque. So it wasn't something I was going to see without a flashlight or without someone showing me it was there. Yeah.
And then the mold you had from the dishwasher, give it to me again.
Stachybotrys.
I was going to say that, but I didn't trust myself. So that would be black mold.
That would be black mold. Yeah. That's like, I'm not a mold expert in terms of knowing a lot about mold, but from what they tell me is Stachybotrys, a black mold, needs like a constant water intrusion, where like something like Aspergillus just needs dampness.
Okay. And that makes sense to me what you said about ebbing and flowing, because I felt much the same in my home in the spring or the fall, or maybe even some days during the summer when it was cool enough to leave the windows open. I feel good in my home when the windows are open. But when the windows are closed and the humidity is high, that was another thing that I noticed. I got one of those little weather
I have
boxes.
them all over the house. Yes.
And I noticed when the humidity was higher, I had more difficulty, not just breathing, but I just didn't feel well in general. So I run a dehumidifier through the warmer months constantly to keep that humidity down. So there's got to be something to that combination. And in all my research and all my listening of all these podcasts that I've been binging from doctors and, medical professionals and mold inspectors and whatnot, and mostly the medical professionals, I have learned that there's like a triple threat with mold exposure, Lyme, and COVID. So if you've had those three, it's like you're in trouble.
Yes, I have.
And I have too.
Yeah, exactly.
So I can kind of resonate with your story a little bit.
Yeah. But I think what's interesting is actually during all of this, I was diagnosed with fibromyalgia by a rheumatologist, and I don't have that anymore. Yeah, I don't have any of those symptoms anymore. They're all gone. All the body aches, joint pain. I mean, it was so severe. Nothing took care of it. It would hurt when I was sleeping. Yeah. So, but terrible. All of that is gone. And I think my husband and I kind of held our breath with the mold thing because we had never heard of it. And so we kind of held our breath that would be the answer. And it really was.
Which is fantastic. So you told me that you had a kitchen remodel or a kitchen remediation. And you said that you lived through the remediation. Did it happen in stages?
Yeah, well, so first we actually gutted our master bathroom just in case, because it's a master bathroom. And so we redid that. Then he did the kitchen, and then we had a whole new HVAC system put in. We needed it. They actually found some mold in there. And then we have carpet upstairs, so we eventually got new carpet. And then on the bathroom on our main floor, it had hardwood floor, which I have no idea why in a bathroom. So they tore that up.
I've seen carpeting in a bathroom. It's like, why?
I know. I will never even have hardwood floor in a house again because it's like a sponge with water. So I would be afraid to have it. We do have it still, not in our kitchen, but yeah. And we had hardwood floor in our kitchen.
So what do you have now?
Tile.
Yeah, me too. I actually tiled my entire home after.
Well, that's what I want is like our next house. I want it to be 100% tile.
It was so expensive and it was so labor intensive, and I was able to help with a little bit of that because we knew the contractor. But I think on my next home, if there is a next home, if I buy again, based on what I've learned and from other podcasters, construction-minded podcasters, I'm kind of leaning more towards concrete floors with a ceiling and a buffing, kind of thing. So I was looking at homes recently, and when I got the quote for an all tile floor, I was like, you gotta be kidding me. Just a few years ago, I did that for like $6,000. Now they want like upwards of 20, between really? 20 and 30,000. I'm like, no, I can't, no. So I'm kind of leaning more towards concrete floors, and I could get down with that.
Oh, I think it would be great. Yeah.
I have a dog and he's super, super clean, but I'm just thinking, kids, dog. I mean,
Oh, yeah.
yeah, we could live on concrete floors. Of course we can. It makes cleaning so easy.
Yeah, I would love to not have a basement in our next house, but I don't know.
Yeah.
We'll see.
There's pros and cons to that. I like the idea of a storm shelter, but I hate the idea of potential mold growing down there. And so back to your remediation job, you said offline, you told me that every time they came in and did another phase of the job, they warned you that you wouldn't feel good or you might not feel good through that. And you said your symptoms, they did flare up.
Yeah, definitely when they did the kitchen.
Okay.
Yeah, it was bad. Yeah, to the point where I wasn't able to drive, and my daughter had to drive me places to like pick up my son. Not for a long period of time, but just a short period of time while all that was stirred up.
Yeah.
So
I've been there for sure. I've been afraid to use knives in the kitchen or mow the lawn.
Yeah.
Like anything that has an element of danger to it.
Yeah. Because even like back then, I'd go to the grocery store and it wasn't dizzy, but I felt off all the time. I had to hold on to the cart, and I still did my regular every day, but it definitely impacts you in weird ways that you wouldn't even think of.
And do you still live in the same house now?
We do.
So it is possible to remediate a home and live safely in it afterwards.
Yep. Yeah, the company that did it, they have like a solution that they use, and it's like turns into water and then it evaporates, and so it is supposed to get rid of all the mycotoxins as well. I don't even know what worked, but it worked, so I'm happy with whatever they did. I don't know if it was just the remediation of getting all the mold out, or if it really was them using that special formula to get out the mycotoxins.
I've been told by medical professionals that people like myself who have an autoimmune issue, I have Lyme as well. So people who have autoimmune issues, the elderly and infants are the ones that are most susceptible to mold and the toxins within mold. Did you have any issues with your infant?
No, I mean, I was the only one in our family that was sick. The mold company we used, they had asked if I could take phone calls from people that were potentially looking at them as treating their house. And people would call me, and it usually was like one family member. I remember one woman called me, and her husband was the only one that was sick. But he was the breadwinner, so it was really difficult. So they were moving out of their house when it was remediated. So it was really trying for them. So
it's very encouraging that you were able to stay in the house and heal and thrive afterwards. That's very encouraging. I've wondered that myself because I went back to my house post remediation and I can't make it.
Yeah.
And I think in my case, I need to get rid of all my personal things. The more I get rid of, the easier it is.
Yeah.
So it could just be the belongings part.
Yeah, and I think I used to be on mold boards years ago, and a lot of people did get rid of everything. And when the mold company came in, they're like, you don't have to get rid of everything. You don't have to get rid of anything, really. We did get rid of a lot of things that we didn't want or need, especially things like stuffed animals and just things that like I just did not want in the house. But yeah, we were able to keep. I mean, I was shocked too, but we were.
Yeah.
And
well, that's good.
Yeah.
I love a success story.
Yeah.
Glad to hear it. Because I have been wondering that question for a while now. Like, am I doing the right thing, putting my house up for sale and getting rid of everything? Am I doing, and I know for me I am, because while I'm in that space, I don't feel great.
Right.
But when I get out of it, I feel fine. But then I question, oh goodness, I've just invested so much money in this house. Is this the right move? And at the end of the day, for me, it is. But it did make me wonder: is it even possible for somebody to come in here and live safely? I want to have a clean conscience when I leave my house.
Well, exactly. And that we had a realtor come over before we decided, are we going to move or what are we going to do? And she said, well, you have to divulge that there's mold.
And I did.
Yeah. So. So we decided to remediate. Now, I will say that I will be excited to move at some point, but also afraid because I have nightmares of like mold being like all over closets or water flowing in closets because it's like a PTSD from the mold.
You say that, and I like to think I'm a rational, logical person. When I came back from my parents' house after a stay away while the remediation and the build back was happening, I come back home And I had such anxiety and my chest hurt so bad I thought I was having a heart attack. I had such PTSD over this just from being in the house.
Right.
I mean, it took me a good couple of weeks to get over it. It was pretty
Mhm.
bad. And I
It
thought,
is.
oh my goodness, this is kind of embarrassing, but I can't
Yeah.
help it. I can't control it, you know?
Mhm. It is. It is definitely hard because when you go from being a healthy person to being that sick, it really messes with your mind.
It does. And I think my body remembered it. I think it was like
Mhm.
muscle memory for my body too. Because while my brain is like, hey, it's been remediated, you're cool, everything's fine, my body was like, I'm
Right.
not listening to what you're selling, sister. It's kind of funny.
Right.
Okay, so by trade,
Mhm.
your area of expertise is in nutrition.
Mhm.
Right. Okay.
Yes.
So the audience is aware. Some of my largest problems throughout this process is that I could not tolerate hardly any foods. I mean, I can pretty much count them on one hand what I could
Mhm.
eat safely for quite
Mhm.
a while. So I want to ask mold and mycotoxins, and I
Mhm.
understand there's a slight difference between the two, but do they impact our ability to tolerate foods? Do they contribute
Mhm.
to food sensitivities, or is this like all in my head?
No, it's not in your head. I'm not like a mold expert in terms of, a mold remediator or a mold inspector. So
Sure.
they're the ones that know all about the mold. But I always think of mold as something you can see and mycotoxins as what comes from the mold that's airborne, that's everywhere, and that's what's making us sick or compromising our microbiome. And because it can compromise our microbiome, that's when those food sensitivities can come. So I always tell my clients, our body doesn't just decide, oh, I'm going to be sensitive to a certain food. Generally, something has happened, and it doesn't have to be mycotoxins, but it can be something that compromises our gut. It causes dysbiosis, which is, our bacteria counts are off, and it causes intestinal permeability, which is also known as leaky gut. And it's a real thing. I used to think that was like a pretend name, but I was at University of Chicago and the GI doctor talked about leaky gut there. So I was like, okay, they're actually using that terminology. So that's what perpetuates those food sensitivities. So once you fix that issue, whatever that issue is, if it's just kind of an internal issue or something external contributing to that internal issue, most often those food sensitivities can get fixed. Some people choose to stay off of, gluten or dairy or really watch their sugar intake. And I work with a lot of GI issues, so I see even outside of mold or mycotoxins is people, get down to 10 foods or less just because of symptoms. So then, the goal is how do we work back those foods in? And when there's an outside element like mycotoxins wreaking havoc on our body, it takes longer to get there. So,
On average, do you know how long?
in terms of like food
Or is
sensitivities,
everybody different?
I would say everybody's different. In terms of like the mold or the mycotoxins, it's more about where are you getting exposed? Is it at work or is it at home? Obviously, if it's at home, you have to remediate or you have to move out. And then if it's at work, people have to make a decision of what they want to do. I don't like this word, but it's the only word I can use is that detox component's very important. And or because not everybody can get out of the mold, but getting out of the mold too. So I feel like the sooner you get out of the mold, the quicker you're going to heal and the quicker you'll be able to introduce those foods back in. But some people can't get out of the mold, so it takes longer. But I still encourage that detox component, even if they have to live in the mold.
And what do you mean by detox component?
Well, a lot of times people will take like a binder. Some of them are like a pharmaceutical binder. Others are like an activated charcoal. Different supplements as well, maybe like the glutathione. And also, I always try to get my clients to sweat if they can sweat, even Epsom salt baths or infrared saunas or some way of sweating, but kind of that detoxing. And so everyone's different. Like for me, I was on pharmaceuticals for like 2 years detoxing and then went to activated charcoal. But I got an infrared sauna, and I don't use it as much in the summer, but I still use it.
I'm going to interrupt. So when you said 2 years detoxing, was that before you knew you had mold in the house or after remediation? Do you remember?
That was even before we remediated, I started.
Okay.
Yeah, because we didn't know if the mold was in a workplace or in my home. And kind of going back to that initial story, the initial company that came to my house said my house was fine. And I knew it wasn't. We had the air conditioning or the heat off before we turned the air on, had the windows open. I was feeling better. And then the minute we turned our air conditioning on, I started to feel miserable again. And that's when I was like, no, I'm going to hire somebody else to come and inspect. And that was another company that found everything. So I was already like on that detox pathway before I got remediated.
Gotcha. Those were a lot of things that helped me too. And then when we were talking about the seasonality and having the windows open, what I'm thinking is in summer, we talked about the windows open and the humidity, but in summer, I mean, I don't know about you, but I sweat a whole lot more. I spend a lot of time outside.
Exactly.
And if I'm working on the yard or I'm walking the dog or whatever, that could also explain why I feel better during the warmer months and I feel miserable in the winter.
Right. Because we can even sit outside in the summer, even if it's warm, we can sit outside of an evening where we're not going to do that in the wintertime.
Yeah. And the sunlight too, I also found made me feel a whole lot better. I felt like a flower blossoming. I did not know how important sun was until I went through this whole episode, and I could just sit out there and soak it in. It felt so good, and I felt so good being in the sun.
Yeah, exactly. I was really like chronically cold during that time. Now I'm not. I'm
okay. So I
quite
have hope.
warm. Yeah, yes, I'm quite warm all the time now. I can't even imagine being that cold again. But yeah, it's like my body finally regulated itself.
I laugh, but I don't know. It wasn't very long ago, maybe about 3-4 weeks ago, where it was summertime and I was under a heat blanket. I mean, I was freezing. I was absolutely freezing. My body just could not regulate its own temperature.
That's how I was. I was freezing all the time. So now I'm not.
Well, that makes me feel good too, because I'm like, oh goodness, am I going to have to move like out west? I don't want to move down south. It's too humid, but maybe out west. Am I not going to be able to stay here in this area? Because I can't tolerate winters anymore.
Well, I know. That's what my husband, back then we would talk about moving, like going south in the winter eventually. Now I would never. I'm like, ooh, winter time's coming.
Oh, total change. That's very fun.
Yeah.
Okay, so back to the food sensitivities. In this journey of mine, I had discovered that there were some highly moldy foods that I needed to be mindful of while recovering, and that was news to me. Can you add a little color to that?
Yeah, there are certain foods that are thought to be more moldy. Some of them being like coffee is one of them. Nuts, grains are thought to possibly be moldy as well. For me, I really wasn't that careful about it. I think because I was very overwhelmed with not feeling well and just eating what I could eat. I did make sure that I got like a low mold coffee, even though I don't even drink coffee now. It was kind of a thing, and because I have to have too much sugar in it. So I think the biggest thing, what I try to hone in on now with clients, for not even just for mold, but for everything, is really being mindful of sugar intake, especially like added sugars. And then if they're big carbohydrates, depending on what types of carbohydrates they're eating, being mindful of what types of carbohydrates and how many carbohydrates they're eating. For me, I was so nauseous through all of it that I didn't even really think about the foods being moldy in a sense. And it was probably something that I learned about later. But I think for some people, like you were talking about, it can be a big player in how you feel.
It was for me. I didn't know about any of that. I had no idea that coffee was prone to mold. I do the clean coffee now. And I had to do research. My doctors gave me some suggestions, but I had to do more research. And in my research, I found that spices could contribute too. And I was like, oh, well, maybe that's why I can no longer tolerate any spices in my food. So this has been a really expensive event in my life, with the medical bills and the remediation and then putting the house back together. And then when I think about all the extra things I did, the saunas and therapies and whatnot, and then you get down to the food. And I remember going through my pantry and my spice rack, and I grew up with little means. I hate to get rid of food, but I just couldn't help it because I felt so terrible. And I was just dumping stuff, just throwing stuff away. I threw all of my spices away. I had such a bad memory and such brain fog that I would forget which things didn't make me feel good. And I'm like, oh, crud, I keep doing this. Why did I do it to myself again?
Yeah, right.
So I ended up just having to toss it because if I could see it, then I would use it. I just had to get rid of things. And even when I would buy new things, I went through various stages where I couldn't tolerate, say, like something on the high glycemic index was a big deal for me, or something high FODMAP for a while was a big deal for me, but I didn't know that at the time. So as I'm going through it and I'm trying to understand what will my body take and what will it not take, the sheer amount of food that I threw away and how much money, because I'm buying organic or I'm buying pasture raised or wild caught or grass fed, that is not cheap. And then tell me a little bit about the organic. You were telling me
what the mold guy? He had just mentioned that because organic food is not sprayed, that they can be a little bit moldy. So to make sure to really wash it, or even have like one of those spray washes.
That explains why one of my physicians had suggested that I wash my fresh produce in vinegar, like a vinegar bath. And I was like, I'm not doing that. That sounds disgusting.
Yeah.
But now when you tell me that, I'm like, oh, okay, now I understand.
Because I don't know if you did like a urine mycotoxin test, but it measures if there's mycotoxins. Because some of those little elevations can be from food. So, again, certain foods are moldier than others.
Yeah.
So, yeah.
It was very interesting. I learned something new throughout this process. It will stick with me forever. I'll be cognizant of it forever.
Yeah. But a lot of times when people come to me for GI issues, they may be following like a low FODMAP diet or taking all these foods out. And then a roundabout way, after them telling me it's not just GI issues, or maybe they've had other people have mentioned, well, maybe you're sick from mold, or we start looking outside the box. So a lot of times, like you were saying, they've already taken foods out because they're trying to get control of symptoms.
Yeah.
So it could be they're already low FODMAP, or most of them have taken out gluten or dairy, or maybe even gone paleo just to try to get control of the symptoms.
I did the same. Okay, so to wrap it up, bring it full circle, what advice would you give to those that might be going through this now on how to overcome food intolerances?
So I think the biggest thing is whoever you are working with, if it's a functional doctor or a functional nurse practitioner or a functional provider of some sort, is one, if you can get out of the mold, whatever that looks like. If it looks like moving, remediation, if it's a job, some places are open to talking about the mold and some of them are not. Yeah. I've known people that have had to change jobs, or maybe even like schools if they're a teacher, because schools sometimes are notorious for mold.
That's scary.
Yeah. I always say things with flat roofs are scary.
Oh, true.
But I feel like detox for somebody that's been sick from mold is almost a lifelong goal. And it may not be the same as what you did when you were in the thick of it, but just knowing that if you're susceptible to getting sick from mold, it can be anywhere. I mean, obviously it is anywhere, but it could be in buildings that you go in every day. So thinking about that detox component basically for the rest of your life, in terms of, I still do it. I do my infrared sauna more in the winter time, but I'm always making sure that I'm detoxing in some way. And again, I don't love that word.
But I'm with you. I love a coffee shop. I really like a mom and pop shop, but some of them are in older buildings, or there are other places of business that I've frequented, maybe old libraries even. I go
books,
into, yes. Definitely the books. Oh my goodness. I visited a library in Rome and I was so excited to be there. And I was so miserable at the same time because I could not breathe. And I went to Half Price Books. I used to love that place to look around, and I was like, okay, I wasn't in there 5 minutes. I had to leave. That had never bothered me before. But I get you now about the lifelong detox, because when that happens, what's the first thing I come home and do? I chelate.
Right. Yeah. And I just think it's not something you have to do every day like you did before, but still staying up on it, I think is important.
Yeah, that's a good piece of advice. So for anybody who's out there who's struggling, not just with a mold food intolerance related issue, but any kind of a GI issue, or interested in what other kinds of things do you do nutrition related?
Well, I do take insurance, so I get physician referrals for things that are not GI related, but I see anywhere from IBS to small intestinal bacterial overgrowth to things like Crohn's, colitis, EOE, Ehlers-Danlos. I mean, I see a lot of different autoimmune and GI issues. So because I was sick with a weird illness and I did have to go the functional route, I tend to kind of merge a traditional, functional, integrative way of looking at nutrition. So it's not just, one way, or it's kind of looking outside the box in terms of how I work with my clients.
Really glad that you mentioned that about the insurance. I had completely forgotten about that, but in the heat of the moment when I was broke because of all of the medical bills and the expenses, it was such a relief to find somebody that would accept insurance.
Right, yeah. Yeah.
Well, because I was, going to a lot of functional practitioners.
Right.
And, it's cash. So.
It is cash, yeah. And I feel very lucky that I can take insurance. So, yeah.
I'm really glad you reminded me of that. And how would folks get a hold of you if they'd like your help?
Email is probably best. I'm changing my phone number right now. And so I don't want to give you my old phone number, and I don't remember my new phone number yet.
We forgive you.
Yeah. It's Valerie, Valerie at bluetreenutrition.com.
Excellent. Well, Valerie, thank you for contributing to the conversation. We really appreciate it.
And thank you for having me.
My pleasure. I thank Valerie for sharing her knowledge and giving everyone such a clear picture of how mold can create hidden food intolerances. I'm glad to know I'm not crazy, and it happens to other people too. Her guidance has been life-changing for me personally, and I'm confident that other people will benefit from it too. Now that we've talked about how mold impacts the foods we can tolerate, I want to shift the conversation to the bigger health picture. Mold toxicity isn't just a nutrition issue. It can disrupt nearly every system in the body. That's why I'm glad to introduce my next guest, Alissa McDivitt of Spark Vital Health. Alissa is a nurse practitioner and certified functional medicine provider who helped me navigate the complex health issues mold created in my own life. She's been instrumental in helping me move forward, in fact, regaining health to the point of being fully functional when other providers had reached their limits. Please welcome Alissa. Alissa, I know that there's a practitioner-patient confidentiality agreement, but I don't mind sharing with the audience that you've been treating me for the past few months, and I've been under your care, and if there's anything about my situation, we can just speak about it freely in the course of this conversation. But part of the reason that we're here is because through this experience, I have learned a great deal, and I had no idea how common mold exposure is in homes, how often it impacts the inhabitants and their health. I think we just grew up with moldy things, and it was just a part of life, right? You see it, you ignore it, and you move on. And I had no idea that it could have such a big impact on people's lives. And so I'm just going to ask the question, in your line of work, how commonly do you see it? How common is mold?
Mold is very pervasive, but it is often hidden. And these shocking statistics reveal that nearly 47% of U.S. homes and over 85% of commercial buildings show signs of water damage or mold risk. 50% of those homes have mold growth, and they may be hidden. There may also not be any smell. You will not have any idea unless you are looking for it specifically through testing or having maintenance done regularly. Some places to consider where mold hides that you should check or suspect are inside the walls, the insulation, under the floors, the HVAC system, air vents, upholstery, mattresses, appliances like coffee makers, dishwashers, garbage disposals.
People think I'm kind of crazy because I don't have a dishwasher in my home. I did not put a disposal in when I remodeled my house. When I got a new refrigerator, I did not get one with a water line connected to it. Like, I'm so old-fashioned, but there's a reason for that, because each one of those things has contributed to some sort of water damage in homes past, and I absolutely refuse to deal with it anymore. So I just proactively don't have those things in my home, and I get made fun of for it, but I don't know. You live through it once, you don't want to have to go through it again. And what do they say? Ounce of prevention is worth a pound of cure.
Well, the statistics make me think about this a little further, like how many people are affected then. And also, I wonder how many people don't even realize that they're being affected. There's an estimation that at least 4.6 million U.S. asthma cases, about 21% of those roughly, are triggered by mold or dampness.
I believe it.
And so if you are a person who is susceptible, you want to look at the genetic propensity, but not everybody gets a genetics test to see how they can optimize their health. But if they are a susceptible person and have like the genetic SNP of the HLA-DR haplotype gene, then they're going to want to be proactive about this. And what I mean by that is make sure you get like a hygrometer and that you can measure the humidity inside your home. And really, for a susceptible person, it should not be above 40%. Mm-hmm. Now, the EPA will say that between 40 to 60% is okay, but if you're a susceptible person, then that may be the range for mold to grow or you to be susceptible to getting mold. But above 60 is when mold can also grow in the environment.
I believe that. And that kind of strikes true for me too, because I call it a weather box. That's how I know it to be, the little humidity reader. And I keep one. And I have also read that it should be somewhere between like 40 to 60-ish, or I've read different ranges online. But I'll tell you, I have a hard time if it's anything above like low to mid 40s. So I have to keep it at low to mid 40s, or even in the 30s, I'll feel better. If it's in the 20s, now we're in nosebleed season. Like, it really hurts. But, something in the 30s, 40, low 40s is where I feel my best. So I can kind of relate to that. I want to backtrack for a second, though, because you talked about a genetics test. What is that? How do you get that?
Well, there are several different genetic tests. The one that I think of that comes to mind is the 3x4 genetics. But there's different ones out there where you could either get a blood test or a swab, and it will give you several different genetic SNPs about whether you're a high methylator or the MTHFR gene.
I've heard of that.
And
yeah.
yes.
Okay, that's interesting. Okay, we're going to have to add that to the list of things that I need to do. I want to know.
Yes, yes. And it can also tell you if you're susceptible to other conditions as well.
Interesting. I definitely want to explore that. Now, I know, obviously we're talking about mold because that's been my personal experience, and it's been such a heavy one that I want to share it with others and kind of raise awareness, I suppose, is what I'm ultimately doing, because I just found it so shocking that my body reacted the way that it did to something that I have had exposure to on and off my whole life since childhood, and nothing like this has ever happened to me before. And it's like, why me? Why now? And I just want people who are out there who are going through something similar, where the folks around them, their friends, their family, who mean well, think that they're crazy and that, they're making it up. And I don't know, I've heard from some family members that I'm lonely, and that when I'm out of the house and I'm with people, I feel better. But when I'm home and I'm alone, it's just I'm lonely and I'm making up these things. And it's like, no, I'm not lonely and I'm not crazy, and nobody would ever want to feel the way that I'm feeling. So I would like other people to know that they can be heard and that they can seek help, and it might not be all in their mind, which is kind of the journey that I've traveled. And my symptoms have been so widespread. In your practice and in your experience, what kind of symptoms do you see? Is there even a generalization, or is it kind of all over the board for people who've been exposed to mold?
It can be just a wide variety of symptoms, and each individual is going to present differently. Even people in the same household, for instance, you could have a family of 4 and maybe only one person gets sick, depending on their genetic and toxic load, your toxic load and your genetic propensity and just the state of your health. But symptoms can overlap, and it makes it difficult to diagnose mold in some people, or they may not think, that may not be high on the radar initially, unless if the practitioner is well versed in mold and they question, okay, environment and then water damaged buildings. And a big clue is how you feel when you leave the environment. Like if you're at your home or your work or you go on vacation for a week, oh, you feel great, you're feeling a lot better, but then you go back home and then you have either nasal congestion or irritability, sleepless nights, you can't lose weight, you're having hair loss, tingling in your hands, cold hands and feet. I mean, a lot of these symptoms could be signs of hormonal imbalance, could be thyroid that they're thinking is going on, or their sex hormones are out of balance, something along those lines. Also, it can be hard to differentiate in people that may have Lyme versus mold. Lyme is more like migrating to different joints, like for migrating joint pain. But definitely, yes, they can have all these different symptoms. What you can do to start, though, I mean, you go to your provider and then try to rule out the differentials, whether it's micronutrient deficiencies or you've got a thyroid disorder. And then you treat all of those things, right? And then, but you're still not moving the needle. You're either not able to lose weight, you're still not sleeping, you're having brain fog, you can't function, you have an exercise intolerance, you can't do what you once did before with ease, and something is off, and you've already ruled everything else out. It's not your heart, it's not your thyroid or perimenopause. Then that's when you go doing a deeper dive and circling back to the health history and asking more questions. And then, if they suspect maybe they have mold in their home, then test the home. And then if that comes back positive, because you want to get that figured out first, and then you don't want to treat the patient, though, while they're still living in it, because that can make it worse, and then you're not going to be able to help them get rid of it because they're constantly going to have that exposure every time they go back home. In the mold, it can be very destructive, right? When you start, we say, poking the bear, it can release these volatile acetaldehydes and things and can just, make the person really ill. So we can support, as a practitioner, support the patient while they're still living at home with their diet and lifestyle, and just trying to manage and doing anything they can, like any adjunctive therapy, decreasing stress, and looking at getting out in the sun is very important to try to heal the body, because mold doesn't like sunlight. And you could do dry brushing to help promote lymph, because mold also, it wants to be still, and it doesn't like movement. And so it's very important to keep the body moving, because then it can't take hold. But I mean, it can disrupt the immune system and of course depress it and everything over time, and affect the hormones and pretty much every body system. But each patient's different. It could affect the kidneys in one person and the liver in another, and your skin. I mean, various symptoms.
So much to unpack there, and so much that I can relate to or I've experienced. When you said that one of the things you could do is get out of the house and see if you feel any better, I traveled for work for years, and I don't do it anymore, but back then I do remember, oh my goodness, I feel great here. I'd go to Texas, I'd go to Denver, I'd go all over the place and I would feel great. And then I'd come back home and I'd feel really bad. But I thought it was the area. Don't laugh at me. I thought it was the area coming back to central Indiana that I was like, oh, well, the air is thicker here, the humidity, or the fields, right? Like we got all these cornfields, and as soon as the plane would land, I would smell that corn, which I loved. But I was like, oh, maybe that's what's making me feel not great. I didn't even consider that it would be my own home. And it wasn't until about the third physician that I saw, and I feel like at that time, that third one was an ophthalmologist of all things. I think it was that third time when he said, "Are you sure you don't have mold in the house?" I was like, maybe I should bite the bullet and check. That was what motivated me, is hearing it over and over again. So many of the symptoms that you mentioned, we know I have gone through.
Yes, and I think I didn't mention digestive. I forgot to mention that, like where you cannot even tolerate any foods hardly at all. It gets to the point where you are eliminating almost everything. Your body just absolutely gets into almost like a shutdown mode where it just doesn't want to accept anything. And like bloating and...
You know what's funny about that is people would see me and I had lost so much weight. I mean, probably like a good 30 pounds. And people would see me and they would say, "You look so great." And I was like, because I'm so sick. Like, they don't see what's going on the inside. The tragic part of all of this is that it's not a visible disease. It's what you feel on the inside. I mean, obviously, I do have some signs of it, the joints and being enlarged and some of the swelling and the edema. And there are other things too. I have the signs, but you have to look really close, or you almost have to know your own body to recognize that change and not mistake it for, say, normal aging, which I get a lot. Oh, that's just a part of normal aging. Well, yeah, maybe over the course of years, but not overnight, just like that, you know? And so people don't see what's happening on the inside. They can't see that you have vertigo so badly that it makes you so nauseous and that you're running into walls and you can't possibly drive because there's no depth perception and you're afraid if you pull into a parking space, you're going to hit the 3 cars around you. You know, people don't see that. They just see, oh, you lost a lot of weight. You're looking really good. It's like, well, that's what happens when you can't eat anything. I'm starving. Like, I'm so starving, you know?
That's the other thing, too. I think that people don't realize that mold, there are a lot of foods out there that can have a high mold content, or we could talk about histamine.
Yeah.
And when you have mold, a lot of times you have a histamine intolerance, and you probably experienced that, but like peanuts are high in mold, and pistachios and beans of some sorts, canned foods and dried fruit. Oh,
I didn't know that.
Cheeses are high histamine,
Don't
but
talk
like
to me
certain
about cheese.
cheeses. But yes,
Like all my favorite foods, pistachios are my favorite nut. I can't get enough of them. And I love Parmigiano Reggiano. And I remember one time when I started to feel better and I was like, oh, maybe I can have that again. And I had just a little bit. And I mean, I blew up. Like I had rashes and all over my skin. And I had just such a huge and immediate response to it. So I'm glad you mentioned that about the cheeses, because that was one I had forgotten about. Can you think of any other foods that are prone to moldiness?
Well, I think the other thing that I just thought about was food sensitivity. If you kind of could be a red flag that you might have mold if you all of a sudden develop all these, you're sensitive to a lot of different foods.
That could tie into some of the other symptoms that you mentioned, but help to rule out like the thyroid you mentioned as one, or some of the hormones. So those things don't cause food sensitivities. Is that what you're saying?
The thyroid,
Yeah.
You're saying? I don't think typically, but it could play a part possibly if someone gets hypothyroid, which can result in constipation and then overgrowth, small intestinal overgrowth, which could like possibly cause histamine intolerance.
True,
Because
yeah.
like if they get certain bacteria that gets elevated in the gut, they can release histamine, and then that could overload you and make it difficult for you to process those fast enough.
Right. Yeah. And the vitamin C really helped me the most with that, I think, of the histamine flare-ups. It was like a sublingual vitamin C. I can't remember what it was, but that was one of the most helpful things. I tried the DAO enzyme.
Okay, yes, with
And
the
it-
spleen,
yeah.
desiccated
And
spleen.
honestly, it didn't feel like it moved the needle at all.
Okay.
But the sublingual spray that I used was kind of a yellow spray, and it was full of vitamin C. That was the thing that helped the most when I was going through those histamine issues.
That's awesome that you could find relief in
Yeah.
such
Yeah, I
a
was like living
limited.
off of that, and it was so expensive for the bottle. Like, I don't know, $70 some for a little bottle. I think you scored it like 4 times. I can't remember. It's been a minute now, but boy, I was going through those like crazy.
And a lot of
I just need
vitamin
to
C, it
stock up.
can cause loose stool, but that's what it does. It helps, helps you detox, just being an antioxidant. But quercetin's also good if you're having a histamine issue.
And some of the other therapies that you talked about, being in the sun. In fact, I'm still learning things because you said that mold doesn't like activity. I didn't know that, but it explains a lot because I would try things and, I would try something new and then I would hit a plateau. I'd feel better and I'd hit a plateau and that wasn't working anymore. And then I would try something different and then I would feel a little better and hit another plateau. And then eventually, I got better and better. But one of those plateau moments was when a friend of mine suggested that I start exercising. She said that she had gone through a similar experience. Now, this is before we knew it was mold, but she listened to my symptoms. Actually, what she said is, I have an idea. I think you're going to hate it. I was like, lay it on me at this point. I'll try anything. And she was like, I really felt much better when I started exercising and when I started sweating. And I said, well, that's not a bad idea. That's a wonderful, will you join the gym with me? And she did. She's the best friend ever. So she joined the gym with me. She's my accountability partner. We go 2-3 times a week. And I'll tell you what, initially, every time I went, I felt so much better. There was such a significant lift that I would crave going to the gym because I felt that much better. So it's interesting that you say that mold wouldn't like movement because that was one of the things that really, really helped. Of all the things I could do, going to the gym. And at the time, I was thinking it was because of sweating out the toxins. But now I'm thinking it's that plus the movement.
And clean water, yes,
Yeah.
just being
And
able to
clean water,
keep things
too.
flowing out and staying hydrated.
Yeah. Another moment was when I went up to the lake house and I stayed with my parents while my house was being remediated. And I was up there for 6 weeks total. And just being out in the sun, I would actually take my laptop out on their table, on their patio, and work most of my day under an umbrella, but out in the sun. And of course, we spent time on the boat and in the water. And I could not get enough sun. I was just soaking it in. It's such a weird thing, too. We talk about all these body changes that you go through. Now, usually when I am in the sun, I'm wearing a big hat, I'm wearing long sleeves, I've got sunscreen on. I'm the kind of person that's trying not to get tan, from all the warnings that you hear your whole life. But when I was up there, I wasn't quite as cautious about it because it was the beginning of the season. It was spring and it was real mild outside. I was under an umbrella most of the time. But just a few days of working out under the umbrella, going out on the boat, I have the coloring that I would normally have at the end of a season. I got it in a few days. It was the craziest thing. I was like, oh my goodness, I'm getting really super tan.
Wow.
I better lay off because I'm going to be in trouble. And you know what else is really funny about that too is when I first arrived at my mom's house, now I'm pale then, right? She looked at me and she was like, why are you so yellow? I'm like, I don't know, but I hadn't noticed it until she said it. And then I started noticing I was very yellow and kind of green, like a yellowish green in color. And after I was out in the sun, I got this nice golden tan going on. And I was like, why am I changing colors? I couldn't make sense of any of it. But having that sunlight and being in the sun, I did feel so much better. So
Yes, vitamin D, a very powerful immune modulator. So that's one key nutrient that is very important. See, in traditional medicine, they would be happy with it being, I don't know, probably above 30 or something. But in functional medicine, 60 to 80 is optimal.
60 to 80, explain.
So the range 60 to 80 for the vitamin D.
You mean the test results?
Yeah.
The blood test results.
Yeah.
Okay.
Yeah.
Gotcha.
So that's...
Yeah. I don't know
Yes,
what
optimal.
mine is off the top of my head, but I know it's very low, even with all sunlight.
Well, research studies show that even like with optimal levels, they see if you have like any thyroid antibodies that are elevated, they'll go down with optimal vitamin D levels.
Everything is so complicated and interconnected.
Yes.
I don't know how you do what you do. Hurt my brain.
A lot of education and continuing education, but that's my passion. Just, after being in traditional medicine for over 20 years, I actually started out in a pharmacy as a pharmacy tech while I was going to school to be a nurse. And then I worked in ICU with all the chronically and acutely ill patients for 8 years.
That'd be hard.
Oh my goodness. It was just watching them, some of them just bedridden, not able to have a quality of life, and on so many medications, one to counteract the other. And then I became a nurse practitioner. That was in 2007. And then I started in cardiology and worked in ER and occupational health and did DOT physicals as well. But yeah, after seeing all of that, just a lot of acute and chronic illnesses, I decided that the goals in traditional medicine just did not align with mine anymore. I wanted to be able to help people more, do a deeper dive, not just be like, okay, you have hypothyroidism and here is some medication, but why do you have hypothyroidism?
Yeah.
Are your building blocks, so like your ferritin, your zinc, your iodine, selenium, what's your vitamin D like? How's your insulin level? I mean, just looking at all of that, looking at the person as a whole and looking at thyroid antibodies and if they were elevated and think, oh, okay, could they have Hashimoto's, or is it from gluten that's causing their thyroid, inflammation, or is it a gut issue? So I try to just do a deeper dive on the patient. And some people may have to have some medicine, when they come to me, they're on medicine, but I've had people greatly improve with diet and lifestyle changes, especially Hashimoto's patients, when you really get down to the foundations of their health and looking at their sleep and nutrition and movement and stress and relationships, and also bowel habits. Those are very important every day, even for any type of patient that walks into my office, especially with mold patients, because you get a mold patient, you want to make sure that they are detoxing every day, not just through their stool, but making sure they're urinating well. Because if you have to do the detox and kill protocol, which is something that you would want to do once the person is out of the environment and you know that their digestion is working properly and that they have good bacteria in their gut, you would want to make sure that they are having at least one bowel movement, a normal bowel movement every day, because you could make someone really sick if you go and try to kill the mold and then they're not able to get rid of it. Yes.
And it's such investigative work that you do. I mean, it's so complicated, but extremely helpful. And I'll tell you, through the course of this, I've tried all kinds of therapies. And some of them work and some of them maybe not so much. And it didn't matter how much I threw at it. I could throw everything at it. But it wasn't until I got out of the environment that I really began to improve and heal. So here I was spending hundreds of dollars a month, sometimes thousands of dollars a month, trying all of these things. And they worked to the extent that I could get up and survive through the day to get to the next day. But some days that's all I could do. It wasn't really until I got out of the environment that my body actually began to heal. And it didn't take very long. I was at my parents' house for a month to start, tried to come back home. House wasn't ready, had to leave again. So 6 weeks in total. And even after just a month, I was able to start adding back some foods that I hadn't been able to tolerate before. At the end of 6 weeks, I felt like a brand new person. My huge takeaway from this is you can treat, and of course, those things help. Don't get me wrong. I mean, they did help. But I like the comment that you made that we really can't treat the patient till they get out of that environment. Until I got out of it, I mean, I was just throwing money at the wind. I couldn't do anything. I couldn't get any better. It really did require removal from the atmosphere, the environment, to heal.
That's a great story. And I could not imagine how that must have felt. for you.
relieving and happy in the end. Like, I don't even want to go back home.
Aww.
Well,
And-
Kirsten, you helped me get there.
And the important thing is too is once you're out of there, I mean, if you improve and you don't need any more support, that's great. But if you do and you need to find out like the exact mold, like by getting a test, that's beneficial because you might need a certain binder paired with whatever the species is to really dial in the treatment.
Yeah.
So there's definitely several steps.
Now we're back
process.
to, or not back to, but now we are building gut health. So adding very gentle probiotics and taking baby steps to help improve that microbiome. And boy, isn't that fun? But at least I'm
Yes.
there. You know? So
Yes. Yes.
Okay, so I'm going to ask a couple of questions before we wrap up. Can you tell me if there are any persons who are extremely susceptible to mold?
Yeah, so I would say anyone who has the genetic, like that HLA-DR haplotype, or if they have a co-infection, if they've had Lyme or Epstein-Barr, some other underlying viruses, or maybe they don't even know. If they had a tick bite and they didn't have a complete full panel, I mean, they could have some other type of infection that maybe didn't show up on their initial testing, or maybe they didn't get tested. But I would say those are the individuals. And of course, I wouldn't discount like someone who's pregnant, right? Or the very young, or especially in a young child who doesn't have an immune system yet, that was just born, and the elderly. So even immunocompromised, or your cancer patients that, let's say, they had chemo. Anybody who's immunocompromised, I would also would want to be proactive in keeping the humidity at around 40% in their home.
That's really good advice. Really good advice. And what should somebody do if they suspect that they have mold in their home?
If they could get out of there, that would be great. Or even if they go for a small vacation, if they're having symptoms, and see if they feel better. They can do a home kit. It's called the Emma test. It's a dust test. There's also this guy that I have followed. His name is Michael Rubino. He has a wealth of information on different air purifiers and different things that you can do. And then you can also, of course, find a well-renowned mold remediation company near you as well. That's where I would start. And definitely, I think, yeah, the dust test, or just where you might suspect it, and trying to test those specific areas would be very helpful as well. And there again, too, I would also just make sure you're doing regular maintenance. Maybe not a lot of people have their HVAC clean regularly, like every season or at least yearly. And
Are you
then,
talking about the ductwork? Yeah.
And then just making sure they just really inspect every room, every part of the ceiling, things like that.
I mean, the sad part of it for me is I was doing all those things, the maintenance things, the keeping the ductwork clean, the UV filter with the carbon, or the UV light with the carbon filter in the HVAC system, the air purifiers in the house, like doing all the things, right? But if it's in your walls, I mean, nothing that you do, it's kind of like what I said about you could throw all of the therapies at it that you want. You're not going to get better until you get out of this, the situation. Well, same thing with the mold in the walls. I mean, you could do everything right, but if it's in your walls, there's nothing you can do other than remediate.
Right. And then if you're doing all the right things, I mean, it could have been there then for a while.
Yeah.
Like maybe at the very beginning, and it got missed, or because, I mean, these are other things I would ask, like if you decide to have somebody come and do it, I would ask them specific questions. Okay, how's your process? How long have you been doing this? And how many inspections have you done? And so I think I would definitely check that out.
The
and
references.
Really be.
I don't mind sharing who I used. I used Midwest Remediation. I know Karen Carr there from the Builders Association, and I trusted her.
They did an amazing job. The remediation company that I hired did an amazing job. I would recommend them over and over and over again. The build back company, maybe not so much, but the remediation went very, very smooth. And I feel real confident in that process because I had hired a third party inspector who was well renowned, very well respected in the state of Indiana. And he came out and did the testing, found the issue within the walls. And then we did the remediation through Midwest Remediation. And he came back out before they did the build back and tested again, not just the air samples, but he tested the wall cavities as well. And everything came back very clean.
Mm-hmm.
He's the one who encouraged me to have him back out and test after the remediation. He says, usually when I work with Midwest, I don't have a problem. Most of the time I come out there, they do a really good job. There's no problem. We move on. I still think you should have it tested just to be sure. And then you'll have peace of mind too. You'll know before you do all of the work that everything was taken care of. He didn't tell me any other remediators that weren't so great, but it at least made me feel good to know that the one that I had hired was pretty well respected and does a good job.
I do want to circle back on a couple of things again. So I want to let people know that I know I mentioned an air purifier, but that does not negate the importance of getting out of the home, and that does not replace you being somewhere else. Like, that air purifier is not going to be able to keep up with the billions of spores the mold is putting out. So number one is definitely getting out of the environment if possible, and knowing about it and living with it is not the greatest idea. Even if you're like, okay, it's in the basement, I'm up here on the next floor, I live 2 floors up, it is going to find you. It can get through the air ducts, or like Jennifer said, it's behind the walls, and your body knows, right? There's this cell danger theory that the body, once it's, set off the cascade of alert, and start this cascade of inflammatory response, the body is not going to be able to start to heal until its mission is complete and it feels safe and it's out of the environment. I just think there is a lot that needs to go into it. Not only just do you have to work on all of these steps of removing yourself from the environment and protecting the body in that way, and working on digestion with repleting the body's micronutrients, and just nutrition's number one, anti-inflammatory, anti-candida, and low histamine. That's a lot to ask for in a person, but as best as you can. And then also, once you're able to digest properly, then you can work on trying to detox your body from the mold, and just going through all those processes. And it's not going to look like a straight line with healing. You might have some setbacks and think, oh, I'm feeling great and I'm on my way and I'm going to go from point A to point B. Well, your body decides, okay, I'm taking a detour. I don't feel so good today, but the next day, you feel great. You'll have those ups and downs, and
I've been there for sure. I correlated it to what I eat. If I eat something my body doesn't like, I do not feel good. Wake up the next day, start over, and I'll eat cleaner and feel better. So I really have a pretty immediate feedback based on my diet and what I eat.
Mold is so interesting, and I could talk about different cases. I mean, just one for more awareness, just like locker rooms, for instance, equipment, hockey equipment, football. I mean, if they're not getting cleaned and they're damp and they're in dark places, you could be infecting yourself with mycotoxins. So I would just have an awareness on that, to check your equipment and don't pass it down from one person to the next. And it's not worth it to subject yourself to that type of environment. And I mean, there's been cases where athletes have been injured and they go through all these protocols. They're still not getting better. It could be like hockey, for instance. And then they finally pinpoint, it's like, oh, it's the gear that's been, subjecting them to these mycotoxins. And once they got rid of that, the patient got better.
That's
so
amazing.
It's like just stuff like that. And
it is interesting. And I feel like we've only just scratched the surface. We could probably talk about this for the next 3 hours. And I would love to hear more of your cases. But for the sake of time, we'll end it there. If there are individuals who are having health issues that they can't get answers to, and they've struggled to find a clear path, through traditional medicine, how can they get in touch with you?
They can reach me at Spark Vital Health. They can either email at Alissa, Alissa, at sparkvitalhealth.com, or they can call my office at 317-449-3958, and I do offer free discovery calls. And I am also still accepting new clients.
And I can tell the audience that I had seen a variety of medical professionals, and there were some where I knew that they did just hit a brick wall and they didn't have any more answers and nothing more to offer. But Alissa, she just kept digging and digging until we figured it out. And even once we knew what the issue was, you still have a road to recovery. And there were times when I wasn't expecting to hear from her because I had already seen her. I had been in her office. And then a few days later, I get a follow-up email or I get a phone call. And it was like, hey, I was thinking about you. And what about this or what about that? So what I want to leave the audience with is Alissa is somebody who really cares about her patients. And if you're out there and you're suffering and you're not getting answers, I can highly recommend her.
Thank you.
You're welcome. Well, thanks for contributing to the conversation. I appreciate you coming in.
You're very welcome. It's my pleasure, and I'm happy to share this awareness with people. I think you're definitely right. I mean, there needs to be more awareness out there that this is a huge problem and that everyone needs to just be aware of the things they can do to be proactive and not just take no for an answer. If someone says, oh, you've got this, but you're not feeling any better and you've already done this, A, B, and C, changed your diet, your lifestyle, you've done all the things. I just highly recommend get checked out, find someone who will listen to you.
We'll end on that great advice, and together we have made a little drop in a big pool of that awareness.
Between Valerie and Alissa, I hope this episode shed some light on how far-reaching mold exposure can be, from what you eat to how you feel to how you heal. If you're struggling with unexplained health issues and suspect mold could be a factor, I encourage you to reach out to providers like Valerie and Alissa who truly understand the complexity of this illness. As always, you can find links to connect with both of them in the show notes. And if you found today's episode helpful, please be sure to subscribe and share it with someone who might need this information. Until next time, I'm Jennifer Goldsby, and this is Renovate Ed.